My name is Madeleine Landholm, and I came to see Dr. Roger because I was diagnosed with hernia that developed because I had an open gut surgery a year ago and it went a little bit wrong. I was hospitalized for 3 weeks and went through some really hard times. So that was quite a painful experience. And after that, I realized, and they told me that I had a hernia and that I most likely had to do another open gut surgery. And that was something I didn't want to do. Didn't want to go through that trauma again. So I was looking everywhere to find another better solution for me, and I came upon Dr. Roger and his robot technique, and I thought maybe that's something for me.
Miss Madeleine came to my clinic a couple of months ago. She has undergone emergency laparotomy a year ago, and post-operative she got an infection. Laparotomy means that they do a midline incision and treat a disease that she had, and afterwards she got infection in the wound, and the wound opened up. It took a long time to heal, and when it healed, she had what we call ventral hernia. That's a defect in the abdominal wall because of the opening, and there will be a big bulge where small bowel or abdominal content will protrude throughout this abdominal wall layer. This can cause a lot of pain, and also it's very discomfort and cosmetically very difficult. The interesting thing here is that she was so certain that she not want to go ahead with another open surgery, which doctors has recommended her to do this, treat this defect. So when I met her, we agreed that we will go ahead to do it, minimal invasive. The operation was done with the robotic technique. With the robotic operation, there will be less complications, less blood loss after the procedure. And even the length of stay is a very huge difference. The patient can go home one day after the procedure when we do it with the Vinci robotics platform, while if we do it open, they will stay in the hospital for an average of 5-6 days.
I had the most positive experience with Dr. Roger first time I saw him. He told me that with the new technique, I would have a much less painful experience, and that he would be able to close the gap in my wound. Thanks to the technique, I had a much better, shorter recovery. I was able to leave the hospital just after 2 nights. I could go back to doing my normal routines much quicker. I felt stronger just within a few days. I definitely believe that the Da Vinci technique is the future.